let's cross over to the head of the Turkish Red Crescent, Dr. Kerem Kinik, who joins us now from Istanbul. Kerem Kinik, good to have you here on the NewsHour. President Erdogan, he addressed the nation yesterday after this coronavirus coordination committee meeting, and he basically talked about how Turkey is dealing with this pandemic much better than other countries around the world. But it looks like, at the numbers, they are almost doubling every day. And your organization, the one that you head, is over 150 years old. You have seen many outbreaks. You have seen many outbreaks like this. How is your organization dealing with this in Turkey?
After this outbreak and the pandemics in the world, the Turkey, as the government, took some measures and adopt some national emergency plan and the national pandemic response plan. And the Turkish Red Crescent has been commissioned by the government for some preventive measures. Then our main also duty to engage with communities, and we are on the field with our staff and the volunteers. Our humanitarian brigades are at the service of communities. For our much needed services in community, we adopted business contingency plan, and our business continuity measures we took, and protective measures for our staff and the volunteers. We have major responsibilities that we cannot pause and let interrupt, such as blood services entire country. We met over 95% of Turkish blood requirements by our voluntary donations. Those we monthly and regularly assist those millions in northern part of the Syria for whom support from Turkey is the only lifeline. We are carrying on our activities.
Kerem Kinik, that's what I want to ask you about. You said that your volunteers, that your employees are out in the field. Now, Turkey is not only dealing with a crisis within its borders, within its own population, with its own citizens, but the reality is that Turkey hosts almost 4 million refugees. Most of these are Syrian. A lot of them are in refugee camps, and these refugee camps are relatively lots of people or high population density in confined spaces. This could potentially be a very big problem. What is your organization doing? We have no difference between the host communities and the refugees in terms of providing assistance. So same business plan, same response capacity for all communities, because we know that the mankind is not a cost or the burden in the health expenditure, the records. They deserve to be protected. Even they are asylum seekers or the migrants or the refugees in Turkey or everywhere. So we are providing basic humanitarian assistance to most vulnerable people, refugees, elderly people, chronic illnesses, and other handicapped people. And we are visiting their homes and asking their necessities and supporting their needs by our volunteers. Throughout our community centers. We are disseminating some protective measures and the policies among the refugee communities in Turkey. In the meantime, inside Idlib. Okay, Dr. Kerem Kinik, the head of the Turkish Red Crescent, thank you very much for joining us here on the NewsHour.